Yeah, sure. I'll start and then we'll see if he's on. If not, we'll change the order around. Good afternoon, everybody. My name is Karen Sims. I'm the Communications Manager for the School of Clinical Sciences. Thank you for attending this Zoom Honours Information session, which will go for 90 minutes. I hope you are sitting somewhere comfortable. I hope you're not driving. If you are, perhaps don't. We are rapt to have you here this evening to be able to explain how exciting and wonderful honours opportunities are here at Monash. I wish to acknowledge the people of the Kulin Nations on whose land we are gathered today, and I pay respects to their elders, past, present and emerging. We were going to begin with Professor Peter Ebling, but I'm not sure if he's on the line yet. Is that correct, Peter? You're not there? No. I know Patrick is on the line, so I think we will go straight to Associate Professor Patrick Weston, who is from the Hudson Institute of Medical Research. Welcome, Patrick.
Thank you, Karen. And welcome everyone. So my name's Patrick Weston. I'm from the Hudson Institute of Medical Research, and I'm representing Liz Hartland, who's our CEO and the head of our institute. So what is the Hudson Institute? Well, we're a medical research institute. We're an independent institute, but we're very closely affiliated with Monash University. And historically, our roots are within the university. So we are a medical research institute, and our primary goal really is to try and deliver medical research that will allow improvement in healthcare for patients within our precinct. So we host, or we're made up of about 450 staff members and students, including very strong cohort of honours students and PhD students. So we run a strong training program that's integrated with our research that allows people to gain experience in research and to produce some of those results that we need to improve healthcare outcomes across the precinct. So those outcomes, of course, are typically published in papers, and that's one of our products, but we also have translation of those outcomes into different areas. And I'll just go to the next slide. Just to give you a context of where we sit within the land, we've got Monash University over here. I'm not sure if you can see my pointer here, but Monash is about a 15-20 minute walk away, so we're very close to the main campus. It's not too far to come across here. We are also quite close to Clayton Station, but most importantly, we're located on the Monash Health Precinct. And this also houses the new Monash Children's Hospital. And this is really important because it means that we're integrated with clinical research and clinical healthcare outcomes. So this is, as the Hudson Institute does research, we are able to translate this research and integrate with clinicians and patient groups on our campus. And this is partly done through the Translational Research Facility, which is part of the Hudson Institute, part of the clinical part of the hospital, as well as part of Monash University. So just moving on to the next slide. Our research covers a wide range of topics, but we really found our research in discoveries that we make in the laboratory. And this is critical for all types of translational outcomes, in that you need to understand how biological systems work and how disease progression works, so that you can translate that into outcomes that will make a difference for patient groups within the area that we work. And so the discovery research feeds into translational research. Sometimes that translational research will do a circle and go back to discovery. And together, those will lead to outcomes which can be translated through clinical trials and into real healthcare outcomes for patients. And so our research really covers the whole gamut of discovery through to translational outcomes. And this is really what we are aiming to achieve. And critically, as a student in this whole progress, you will learn how to do this type of research, translate your outcomes potentially, and these outcomes will lead to health-changing outcomes for patient groups. So just to move to the next slide, hopefully I'm not taking too much time, we cover a range of research areas, including including inflammation, cancer research, reproductive health, newborn health, hormones and health. These look like they're siloed and they may not integrate with each other, but this is not the case. So if you're working in inflammation, for example, you may also be working in reproductive health or in cancer, and the discoveries that you make in inflammation may be then applicable to these other areas. Or if you're in hormones and health, your work may also be relevant for cancer and inflammation. And we also do a lot of work through the MIRCI Centre, for example, in newborn health. And again, these research areas will integrate with inflammation, reproductive health, endocrine state, etc., and cancer. So a good example of a translational outcome or a translational program is the new children's brain cancer research that's being done on our campus. And this is a really exciting area where patient samples are then examined and hopefully are leading to good outcomes for kids in our area. And that's integrated obviously with the children's hospital on campus here. And so you can see the benefits of being in a setting where there's a clinical face to our research as well as the discovery research that we do. So if we go to the next slide, hopefully the outcomes that we make, or the discoveries that we make and progress through these translational outcomes, lead to new outcomes for patients. These may be in cell therapies, in precision medicine, for example. A good example is the recent news that comes out of Andrew Stevens' lab, for example, for early diagnosis of ovarian cancer. And so this is a really exciting area that's been developed recently, and that's built on the basic understanding of how ovarian cancer progresses in patients. And so this is a breakthrough area and an example of the type of research you could be involved in if you come to the Hudson Institute and get involved in that type of work. So next slide. Our student community on campus, we try and integrate very strongly so that you've got a strong basis on which you can interact with other students and like-minded people. This is primarily through the Hudson Institute Student Society, and the HIS organised social events, as well as other more professionally related areas in which you can talk about your research, integrate with other early career researchers, for example, through some of our mentoring programs, and also through, for example, the Hudson Institute Student Retreat, which we had in 2022 and again in 2024, where students, this is a student-driven program that allows you to present your research and integrate with other students across our campus. And so there's lots of opportunities to integrate with other students and to share experiences and hopefully outcomes with those. And I think I'm probably pretty close to my time, so I'll just go to the last slide if I can.
You're doing fine, Patrick.
Okay, great. So this slide really, I just wanted this up for a couple of minutes because it gives you, or a minute or so, because it gives you an opportunity to scan this QR code. And that's going to link you to some of our, a good description of what we do at the Institute, and some of the opportunities that you have as honours and PhD students within the Hudson Institute. So the courses that are available range all the way from honours students or honours courses through masters and PhD by research. These are all accredited through Monash University. They're all supervised by Monash qualified supervisors. You can find the details in the student research handbooks and through the QR code here. Have a bit of a look around the Institute virtually. And of course, if you're interested in coming to the Hudson Institute, make sure that you contact the relevant researchers. I don't think there's anyone here who won't make some time for you if you want to make contact. So don't feel like, don't be shy. Make sure you contact us and let us know your interests, and we'll try and do what we can to accommodate you in the Institute. And thanks for your time. And I think we'll move on from there. I'll hand back to Karen.
Thanks, Patrick. I was going to ask you about the ovarian cancer test, but I didn't have to because you brought it up. It sounds amazing. So yes, the QR codes are there for people to scan, and then brings up a form, and you can then fill out that form and make contact with the people and the institutes that you're most interested in. So please do that. And there will also be a question and answer session at the end, and you're welcome to write questions during the talk and put them in the chat, or even just raise your hand at the end, and then we will go through them one by one. I'd now like to introduce Professor Peter Ebling, AO, who is the head of the School of Clinical Sciences. Welcome, Peter.
Well, thanks a lot, Karen, and welcome to everybody today, and thanks for joining late in the afternoon to hear about the School of Clinical Sciences. So this is where we are located, and we're just near the Hudson Institute, so you've really seen this slide before, but really the benefit is being so close to the clinical activities that occur, and that's at Monash Medical Centre for adults and women's health, and then Monash Children's Hospital for children's health, and that's a brand new Monash Children's Hospital. It's only a few years old. Next slide, thanks. So the good thing about doing research at SCS is that it's big. It has 7 academic departments and 4 Monash University research centres. And as I said, there are 2 academic disciplines which you'll only find at the School of Clinical Sciences and not elsewhere at Monash University. And they are obstetrics and gynecology and paediatrics. So if you're interested in those areas, the School of Clinical Sciences is the place to do your research. Next one, thanks. So just the outputs of the School of Clinical Sciences, we publish more than 1,000 papers a year. We cover every medical discipline. Our budget is very large, $170 million, and we have over about 250 high degree students. So they're doing PhDs predominantly, but we have a lot of honours and master's students as well. So it's a big critical mass, and you will never feel alone. Next slide, thanks. And we just heard from Patrick that we are co-located with the Hudson as well as Monash Health. So this really creates a great opportunity for collaborative research in the Monash Health Translational Precinct. Next slide, thanks. And this is just the building. You've seen a picture of it before. It was opened only 8 years ago, and it has state-of-the-art research platforms, a clinical trial centre and human imaging platform embedded in research platforms and research centres. It also has a clinical trials floor, and importantly, clinicians and basic scientists are co-located so that they can do translational research. Next slide, thanks. So if we think about, there is unlimited scope of medical and scientific domains shown here. And importantly, there are several leading SCS research centres and groups. The Centre for Inflammatory Diseases, which has a rheumatology and lupus group, neuroinflammation research group, a leukocyte trafficking group, and a regulatory T-cell therapies research group. So they're doing innovative new treatments for autoimmune diseases and other diseases based on regulatory T-cells. There's a world-renowned stroke and aging research group, behavioral neuroscience lab, a blood cancer therapeutics laboratory looking at acute myeloid leukemia and other blood cancers, my own bone and muscle research group, and the MIRCI Centre with the Hudson Institute, which looks at women's and children's health. Next slide, thanks. So the research platforms really help you accelerate your research as a research student, and they're all listed there, the various types of research platforms that are available on site, and they go from bioinformatics to histology, medical genomics, and a Monash biobank. And we have the Victorian Biobanking Centre, which is a state-of-the-art facility for biobanking. Next slide, thanks. So it's been very successful, and over the last 10 years, you can see the growth in research income, and currently it's over that time, it's been $475 million, and annually about $70 million in research income. Thanks. And if we look at the high impact factor papers, these are published in journals with an impact factor of 7.5 to 10 or above 10, we can see that the number of these publications is about over 250 a year in these high impact factor journals, so that 52% of outputs are published in the top quartile journals, and 25% of outputs are published with international quality co-authors. And each year we get about 316,000 citations from our publications, and we have some of the highest cited authors in Australia working in our School of Clinical Sciences. Next slide, thanks. So these are some of the high-profile journal highlights. And if you look at the research impact metrics, a field-weighted citation impact above 1 is highly significant, and ours are nearly 3. And the average number of sites per publication is about 40. So it's very important, the publications that we come out with. And you can see some of the areas such as familial breast cancer and IVF, as well as sarcopenia and cachexia. In addition, we can see the outputs in high-level journals, both general and specialty, with a number of publications in the New England Journal of Medicine, Nature, and the Lancet shown here. Now, can a basic scientist flourish at MHTP? Definitely. So this is one of the examples of our high flyers. Dr. Connie Wong received a 2019 CSL Centenary Fellowship, and at her early career stage, this is worth $1.25 million over 5 years. And she was also a tall poppy in Victoria. So Connie's been very successful being a basic scientist, and she works in infection occurring after stroke. So it's got a high degree of clinical relevance as well. Next slide, thanks. We've also been very successful at getting the best theses submitted with the university, and the Molly Holman Medal is an example of this. It's one of the highest academic honours the university bestows, and marks recipients as researchers of the highest order with the best PhD thesis. So we were successful in this at SCS again last year with Hashrul Rashid, a cardiologist, getting it for his thesis about transcatheter aortic valve replacement. and the role of multi-detector computed tomography in anatomical assessment and enhancing clinical outcomes. So we've won this award 4 times over the last 5 years, and the other winners are shown there. And they're from diverse areas within the School of Clinical Sciences. Next slide, thanks. And also we have the 3-minute thesis competition, which is really popular amongst PhD students. And Rana Sawaz was the winner of the Monash University 3-minute thesis. And this was for snotty with a chance of influenza last year. So that was a great presentation. Next slide, thanks. And if you're looking at the variety of honours projects at SCS, it really is a feast of different topics. And these are some of them that you might be interested in looking at that have occurred over the last few years. And some of them are relevant to cancer and others to pregnancy and stroke. So there are lots of things you can do and as an honours student, and everybody really enjoys it when they come to the MHTP and the School of Clinical Sciences, as you can see from their smiling faces in these photos. And next slide, thanks. So this is just to complete some of the high impact publications recently, and we can see a couple of papers from the New England Journal as well as the Lancet. So we really are punching above our weight. And if you link up with any of the researchers at SCS, I'm sure you'll have a very successful honours year and you'll really enjoy it, the experience. Thank you.
Thanks, Peter. That was perfect. Just that photo of the students, it probably wasn't the day to wear a crop top, but anyway, they weren't to know. Thank you. And I'd like to echo what Peter said. It's a big school and lots of activity, but you're not left alone. And that's certainly true at lunchtime, where we have a very crowded kitchen. Thankfully, we have 3 microwaves, so you can always bring your lunch, and we all sit together and chat and get to know each other and learn about each other's work. It's a very collaborative, friendly environment. I can vouch for that. So thanks again, Peter. So now from the Victorian Heart Institute, we have Dr. Kristen Bard, who I can see there. Just to start, Kristen, I'm not very original. How many people do ask you if you're a paediatrician?
Nobody.
Oh, well, maybe I am original after all.
Yeah, maybe.
Oh, I thought it'd be the perfect job for you with that last name.
Oh, that's funny. No, I actually never had that asked in my life, but I'll remember that one.
Okay.
All right. Well, I'm just going to give you a little bit of an overview about honours program available in the VHI. So as you may or may not be aware, the VHI is probably one of the newer centres established around Monash in the last few years. And we've just had our first sort of 6 months in the new Victorian Heart Hospital, which I'll go into in a little bit more details as we go along. But you can scan this QR code to get a little bit more information about the VHI from the VHI website. Can we please move forward to the next slide? And apologies, I've got a couple of animations in the first few slides and then they'll go away after that. But basically, what are we all about here at the VHI and the VHH? Well, really, we know that too many Australians die or are disabled unnecessarily by cardiovascular disease. Can you click forward, please? And it's the cause of 1 in 4 of all deaths. And actually, every 12 minutes, 1 Australian dies of cardiovascular disease. So that's 4 people during an hour-long presentation, probably about 6 by the time we get off this call. So the costs to our economy are more than 15 billion annually, and it's one of Australia's largest health problems, despite the constant improvements that we have. And it disproportionately burdens Australia's First Nations people and those below the poverty line and those living in rural and remote regions, which is really important. Next slide, please. So it's going to take a village to significantly improve cardiovascular disease outcomes in Australia, and that's really what the VHI is all about. That's what we're building here at the new Victorian Heart Hospital, a connected community greater than the sum of all its parts. And so the VHI at a glance, we can see that the Institute was launched in November 2020. And so that was basically launched virtually during the throes of COVID. We now have more than 600 members of the Victorian Heart Institute. This is including people that are on site at the Victorian Heart Hospital, as well as all around the other Monash campuses, including at Monash, Malaysia. We have 5 full-time operations employees and about 7 full-time clinical trials employees, and are rapidly growing in that space. But that's aside from that, we have many academic researchers associated with the department. And there's regular research underway all the time, which I'll go into in a little bit more detail in the later slides. There's also an education portfolio in development here at the VHI, including all sorts of courses about cardiology health. And there's a strategic plan on how the VHI will work. And importantly, we moved into this physical space in the Victorian Heart Hospital, where I'm coming to you from today in February 2023. And it's now a vibrant hospital of its own, focusing on heart disease. Next slide, please. So this is a bit of an overview of the Victorian Heart Hospital. It's going to be Australia's leading cardiovascular research institute. We hope to have 220 scientists in the building by 2026. And as I've already mentioned, we're already connected with a large community across Monash University. So within the actual space for research, there's biomedical laboratories, there's chemical engineering laboratories, specimen laboratory, there's potential for the future class CMV cell therapies rooms, there's a systems laboratory to integrate interdisciplinary workflows, and there's a dedicated clinical trials facility. So on level 2 of the hospital, it's all entirely Monash University dedicated research space, but also on level 1, there's space for collaborative work between Monash Health and Monash University to do clinical trials, and that's dedicated space for clinical trials down there. We also have teaching and education space on level 2 as well. There's lecture theatres and breakout spaces and sim suites as well. Next slide, please. So this is just gives an overview of the 5 grand challenges that the VHI is dedicated to solving. So women's heart health is one, underserved populations is another. We have a big focus on living well, and importantly, a big focus on personalised medicine, as well as developing new technologies. Next slide, please. And this just gives a little bit of an overview of what we look like. So here you can see the building. This was actually an artist's impression. There's updated, you can take a photo from the street now if you'd like. We're located on the corner of Blackburn Road and Wellington Road at the very southeast corner of Monash University campus. It's just about a 7 to 8 minute walk to the middle of the campus centre. I do it on a daily basis. And there you have access to all of the facilities that the campus has to offer. And we also have access, of course, to the biomedical precinct quite easily over the other side of campus. So the photo at the bottom shows an overview of an external view of the Monash University Research Laboratories taken the other day. You can see the corridor entering into the PC2 lab space, and then there's big labs beyond that. There's also a suite of imaging facilities on the ground floor of the hospital, as well as the cath labs where all the interventional cardiology takes place on level 4. And then, you know, we've got all sorts of other activities going on around the place, including patient wards up in the level floors 6 and 7. So the Victorian Heart Hospital really spans both Monash Health and Monash University, and the Victorian Heart Institute fits in mainly under the university umbrella, but of course we have strong collaborations across to Monash Health. And this just indicates all the different emerging facilities that are innovative in the space that will be emerging in the years to come. Next slide, please. So I'm just going to give a quick overview. I think I've probably got a few minutes to quickly talk about
easily.
Some of the projects that we have. So this is just really designed at giving you an overview of the multidisciplinary research here at the VHI. So I've kind of targeted several of the new lab heads that are located within the space for the presentation today. But as I said, we've got over 600 researchers associated with the VHI, where we could probably match supervisors if you're particularly interested in reaching out to other people. But this here is firstly an overview of some of the clinical research going on. So this is 3 of the cardiologists that are working here at the VHH and integrated with Monash University. And they've got a focus on cardiovascular imaging. And so within that research activity, they undertake research programs involving analysing echocardiography scans from patients and participants in clinical trials, as well as cardiac CT images and cardiac MRI. And the research focus is really about developing the pathways for integrating cardiac imaging with clinical management. So it can be a focus from the perspective of developing better tools for the research to be undertaken, as well as utilising these different cardiac imaging tools for addressing specific research questions. There's importance in identifying novel imaging parameters for use in prevention and diagnosis of cardiac disease, and they have applications to artificial intelligence methods as well. Next slide, please. The contacts are there listed below. This slide's got probably too many words on it, but basically just gives a bit of an overview of some of the funded trials that are taking place in the VHI at the moment, funded by the NHMRC or the MRFF predominantly. And that just kind of gives an overview of some of the studies that may have honours students projects emerging, as well as PhD student projects. You can go to the next slide, please. Then we have the molecular nutrition lab. So this lab is predominantly based in the biological labs. They do a whole lot of research using cutting edge technologies to investigate genetic pathways involved in modified nutrition. And their primary aim is really discovering how dietary bioactive compounds can reduce the risk of heart disease and type 2 diabetes using their cellular mechanistic studies and human interventions. And so this slide here gives a list of an overview of some of the things that they do, and the head contact there is Gary Williamson. Next slide, please. This slide is from the CREATE lab. It's the Cardiorespiratory Engineering and Technology Laboratory. So we call these guys the engineers that are down the other end of the lab. And they have a whole bunch of exciting equipment where they're really focused on understanding how to produce better devices for cardiac disease management, including trying to produce a new artificial heart for improving lives of people with heart failure. And so they've got a nice visual slide here indicating some of the things that they do, and the contact for that is Sean Gregory. Next slide, please. We have a group housed here that focus on epidemiological research, and they are mostly focused on the impact of stroke and aging. And so they consider themselves as a translational public health and evaluation division, handling big data, epidemiology and prevention. And so their major areas of research are epidemiological studies leveraging linked big data, registry-based research, randomized controlled trials of novel approaches to supporting people to live well after stroke in the community, as well as primary prevention education programs for stroke, and an economic evaluation of novel stroke interventions. And so this group is quite active here. They've just moved in also in February. They've got the QR code there that you can have a look at in a little bit more detail. And they're led by Dominique Cadillac and Monique Kilkenny. And then we move into some of the more biological preclinical models. So this group here is led by Dr. Ben Chen. Ben's recently joined the VHI from the Baker Institute and has provided two very specific projects here for an honours student. He's keenly trying to recruit students into his new and emerging lab. And so he's got some projects focused on treatment of coronary artery disease, as well as diabetes and diabetic exacerbated coronary artery disease. There's some big words here that I'm not going to muck up by pronouncing wrong, but you can kind of read through that for yourself. And Ben would welcome any people reaching out to get in contact with him about his projects. And then next slide, please. And then this last couple of slides is focused on the group that I'm leading with Professor Stephen Nichols, who's our director. And actually, I'm speaking on behalf of Professor Nichols today. He's currently at the European Society of Cardiology conference presenting some very exciting late-breaking abstracts. So he can't be here for the presentation today. But our group focuses on understanding the underlying pathophysiology and identifying new treatment candidates for atherosclerosis and inflammatory and ischemic vascular diseases. So the picture here just gives a bit of an overview of how ruptured plaques can lead to heart attacks and all the underlying inflammatory mechanisms associated with that. So if you joined our lab, the transferable skills you could gain include laboratory techniques such as assays, PCR, Western blotting, etc. There's potential for doing preclinical models, mainly in mice. There's also a good opportunity for clinical research skills to be gained. For example, recruitment, data management, and good clinical practice, as well as experimental design and ethics adherence. And of course, with honours programs, you develop a lot of speaking and written presentation skills, time management, and organisation. So I have a slide just showing some of the projects that we have underway at the moment in the lab, including mouse models of atherosclerosis to look and see if we can find new interventions for unstable plaques. We're also very interested in vascular ischemia and inflammation using mouse models of high limb ischemia, which gives indications for peripheral arterial disease, as well as using diabetic mice to address this. But we also have some clinical studies underway. We consider ourselves a translational lab, so we're actively recruiting for a new study, which we've just had ethics approval for, to look at atherosclerosis progression in people with clonal hematopoiesis, as well as recruiting people for a study to understand the mechanisms of statin intolerance and also dysfunctional high-density lipoprotein cholesterol. So that's about it. I hope that gave a bit of an overview of some of the projects that are underway here at the new Heart Hospital. We don't have many stats to tell you about in terms of paper or impacts just yet, because we are quite new, but I'm sure that that kind of stuff will start emerging in the next few years. So thank you for the opportunity to kind of give you an overview of that today.
Kristen, that was fantastic. Thank you very much. I went on a tour of the Institute just as it opened, and I learned a lot about wet labs and dry labs. And I was actually there on the day one of the -80s was installed. It was history in the making. It was just incredible. And, you know, how often do people get to work in a brand new place in medical science? It's just fantastic.
Absolutely.
Thank you.
Every day we're kind of doing new things, so that's exciting.
Exactly. And as you say, you can't report on it yet because it's all happening, but yeah, it'll be a matter of watch this space, won't it?
Yeah, absolutely.
Yeah, very exciting. Thank you so much. We will move on to MIRCI, which stands for the Monash Centre for Health Research and Implementation, which you can see why it's also known as MIRCI. And I'd like to introduce Associate Professor Lisa Moran, please.
Thanks, Karen. So I'm presenting on behalf of Professor Helena Teed. So next slide, thanks. So MIRCI, as you've heard, that's Monash Centre for Health Research and Implementation. And so really we conduct research and then we aim to implement it into the real world. So our vision here is to create, synthesize, implement and translate clinical health services and public health knowledge with cross-sector end user engagement to deliver health impact. So we've got active partnerships with all of our stakeholders who we aim to work with the research translation. At the moment, it's about over 120 organisations over 6 continents. We also work within Monash University and Monash Health. So a really unique partnership embedded across both the clinical and the research continuum. We're internationally recognised in a range of areas. So Helena's the top PCOS researcher internationally. I'm the 4th top, which is nice for a dietitian to be recognised in the ONG and endocrinology field. And we also have a very strong research and translation program where all of our students are trained in not only how to conduct basic science or clinical research, but also in the skills required to engage with stakeholders and implement it into the real world. Next slide, thanks. So I think we've talked a little bit about the process from discovery research through to population health research, so bench to bedside. So what I really want to highlight here is how we fit into this. So we've got bench research, or T1, which is basic science animal research, to summarise. Bedside research, maybe T2, T3 research, looking clinical trials, implementation into practice. And then through to T4 research, which is looking more into what we do, which is the health services research, population health studies. Next slide, thanks. So here I think the translational pipeline is the focus of concern across policymakers. So there's a real growing awareness of the widening gap or the valley of death between discovery research and real world practice implications. I don't know how Helena's done her nice animation, so maybe next slide and we'll see what comes up. Keep going. Keep going. Great. So I think what we're really trying to do here then is we're trying to cross that divide between basic and clinical sciences. So really, I guess, looking like the gap between science and humanities here. So we need to eliminate silos between health disciplines, between research disciplines, use our skills to work together and learn together to make that, that greater impact into practice. Next slide, thanks. So what we do at MIRCI is we sort of move beyond the traditional unidirectional concept of translational research. So we work across all the facets and we really feed off each other. And this helps us really then deliver the right treatment to the right patient at the right time. And so ultimately what happens here is that the client or the stakeholders, and it could be patients, it could be health professionals, it could be health systems, it could be government, they're what directs our research. So we don't seek to push our research-driven vision onto stakeholders. Instead, what we do is informed and driven by our stakeholders. Next slide, thanks. So this is well summarised here by the Knowledge to Action framework. This is an implementation research framework, and it really summarises the range of research that we do, but also how the different phases of the research build onto each other and inform and learn from each other. So at the top, we see stakeholder engagement. So this is needs assessment, priority setting of what our stakeholders want done. And this needs to be done with stakeholders. And this could be patients, consumers, health professionals, and beyond to health services, government, and other. Evidence synthesis. So you need to understand what's been done already. And this could be through systematic reviews or meta-analyses or evidence-based guidelines. And this is to know what's been done in your stakeholder chosen priority and what gaps there are still. Then when you know what these gaps are, you may be conducting further research here. This could be basic or discovery research still. This could be epidemiological research. This could be implementation research. But here it's co-designed with our stakeholders to make sure we're doing the right research for the right reason. And then we lead into implementation effectiveness research. And once we know what our stakeholders want, we know if it's been done, we know if we need to do anything else, then we conduct research in our health system setting, and then eventually work to translate, scale up, and look at our broader policy and economic impact as well. Ultimately, it's a complex endeavour. It involves us having to understand a lot about behaviour change at an individual level, at a patient level, at a health professional level, at an organisational system level as well. Next slide, thanks. So really what we do is we generate high quality research that deals with real world problems. So we establish what matters to our end users, and those are our stakeholders, and they're central in all the research that we do. We establish what works, what's effective, and we establish what can be implemented in a real world setting. So what can be realistically translated into a real world clinical health environment, and then look at actually what can be scaled and impact up on a broader setting. Next slide, thanks. And so it's really about trying to take a broader view of the problem, then to focus in on what needs to be done at any particular time, but each piece of the puzzle contributes to the larger health problem. That was me trying to interpret what Helena wanted from that cartoon there. Next slide, thanks. And so keep going. There's a few little pickies here we're seeing. So we're working across lots of disciplines and lots of sectors. So IT, digital health, engineering, design, medical, allied health, sociology, psychology. So this really means that we all learn from each other. So I'm a dietitian. I'm not working in a dietetic department. I'm working in a broad multidisciplinary department, but I'm learning implementation research here to apply across a range of sectors. So it's about luring people out of their rabbit holes to gain unique skills across disciplines. Next slide, thanks. So we have a range of platforms within MIRCI, which all of our scientists and students can learn from. So this can include biomedical research, biobank generation, biomarker assessment, and discovery research, clinical trials. These can be efficacy trials, or these can be implementation or effectiveness trials, where you look not only at an isolated environment, but a real world setting. Big data and statistics and machine learning. Say one example is at Monash Health, we have access to all the data collected from every birth going through the largest health system in Australia, so 10,000 births a year. And so we have the opportunity to do like amazing predictive statistics within this sector. Implementation science research, which means where you try and work out, can you implement a clinical trial result and intervention into a real world setting. Large-scale partnerships across community, government and health services, and broader public health research for maximum impact as well. Next slide, thanks. And so, this is very small for me at my end. Sorry, I've just got to zoom. Okay. So we've got a range of disciplines that we work across. So public health, we have research in healthy preconception, pregnancy and postpartum. Polycystic ovary syndrome, a lot of research in this space. early menopause, reproductive women's health. The platform I lead is healthy lifestyle in high-risk women and cardiometabolic disease prevention, gestational diabetes, gender equity and leadership research, women's heart health, and diabetes and cardiometabolic health. And then in that second column there, we see some of those methodologies we talked about before, but that really covers, big data, machine learning, risk prediction, trying to look at the health system as a learning health system. How can we continually learn from the data that we gain from patients and consumers? Looking at healthcare improvement, consumer and community involvement. We've got, great skills in evidence synthesis and meta-analyses, including in individual patient data. Great skills in qualitative research, which is actually, talking to our stakeholders and our consumers in different ways. Clinical trials, digital health innovation, and health economics as well. And then also in capacity building and training, this is what all of our staff members and all of our students have the opportunity to learn, really, which would be clinical trial skills, implementation research skills, biostat skills, really trying to support women coming through in a research role as well, how to be research leaders, and content knowledge across fields such as women's health in a range of areas and lifestyle medicine in a range of areas. Next slide, thanks. So I think what we do is quite unique because we're one of the only 2 implementation centres nationally. The other one focuses a lot on community health. That's up in Newcastle with Luke Wolfenden. They do fantastic work. What we do is actually embed research into healthcare more in the public health sector. And public hospital sector here. And so multidisciplinary in nature, multi-sector in expertise, and our work actually has been published in really high impact publications. So New England Journal, JAMA, Lancet, Nature series. So our work's recognised really as taking all the elements from discovery through to clinical, through to stakeholder engagement, through for ultimate impact as well. So I think this is where students starting out can really try and make an impact through working with us with the skills that we develop. Next slide, thanks. And I'll just finish off with a snapshot of a few of our projects. So Aya Musa is the head of our lifestyle-related disease biomedical work. She does a lot more of the discovery research, biomed research. She's setting up fantastic biobanks at Monash Health, particularly in the pregnancy space, so in healthy and complicated pregnancies. And she's got a lot of research projects which involve collection and analysis of samples for a range of biomarkers of metabolic and reproductive disorders, looking at responses to lifestyle or pharmacological medications, and also looking at the effect of the different mechanisms of diabetes and metabolic and reproductive conditions in here, and how this is altered by lifestyle or pharmacological therapy. Next slide, thanks. I've got a few slides up here as well, a few projects up here, sorry, on qualitative implementation and clinical research. We're in the process of developing shared decision aids, which are tools that consumers and health professionals use together to communicate risk about conditions and communicate treatment options. We've got a range of stakeholder engagement qualitative research projects happening, some which would be quite good for an honours project next year, which would be looking at barriers and enablers to provision of lifestyle management to people working with infertility. We've also got work on trying to improve referral pathways from hospital-based care to community-based care for women with PCOS. And so trying to really work with some of our community partners here, Diabetes Victorian, Diabetes Australia. We're looking at a methodological framework here of trying to improve reporting guidelines for how lifestyle interventions are framed in the research literature. And we've also got some NIH relationships with US-based psychologists on collaborative parenting and seeing what effect this could have on maternal lifestyle and maternal anthropometry. Next slide, thanks.
Is this the last slide, Lisa?
Yeah, pretty sure. Yeah.
Right. Okay. Thank you.
And Sandy Braff is our community and engagement lead, and she has got a range of projects up here, which is about understanding how we improve engagement with our partners. So, developing recommendations for how to actually run workshops and engagement activities or narratives of excellence, trying to map on a national level what our organisations could be who want to be conducting community and consumer engagement, and really sort of looking at ways of trying to improve quality appraisal within community and consumer engagement as well. Pretty sure it's the last slide next. Thank you. Sorry if I went over time.
No trouble. That was fantastic, Lisa. Thank you very much. Thanks to my job, I learned of the PCOS app, and I've sent that on to many friends and family members. And to think that, we're a tiny population in Australia, and to think that Monash is leading all that and is responsible for the new guideline, it's pretty amazing. And of course, when we say guideline, there's something like 398 points to that guideline. It's fabulous work. Can I ask a question? Is the valley of death the distance between discovering the drug or the treatment and getting it approved and to market?
So, I mean, I think there's valleys of death at each stage, but the one we even see is even from T3 through to T4.
Okay,
so,
gotcha.
So you might even have the clinical trial published. You might have it published in a fantastic journal, but then how do you actually have it, used routinely? So I did honours in about 20 years ago, and I published a paper in a high impact journal on high protein diets looking with PCOS. And 20 odd years later, and I'm working clinically in this space, and people are still asking me questions about it. It's still not routinely understood. So
goodness, yeah. Wow, you're ahead of your time. Do you feel like saying "I told you so" to everybody? Thanks, Lisa. That was terrific. So now we have some students to talk with. Could I please have the spotlight on Liam Allen, Lacey Klompmaker, Paige Riddington, and Kayla Kochaya, please? Can they come up? Hi, Liam.
Hi, Karen.
Can you say the names again, please?
Oh, sorry. Liam Allen, he's up. Lacey Klompmaker, Paige Riddington, and Kayla Kochaya. You can see Lacey's up. We'll start, Jim, because I know you'll find them. Liam, could we please hear from you? Could you tell us a bit about yourself, your first degree, what you're doing with honours and with your honours qualification, and what made you decide that topic?
Okay. I'm a bit of a curveball here, so I didn't actually do my honours at the MHTP. I'm doing my PhD now with them, so they thought I might be an interesting perspective. So I did a Bachelor of Science in Pharmacology and Physiology. I did a third-year research project looking at free fatty acid receptor agonists in asthma. And that continued on into an honours project in the Department of Pharmacology. That was also the year of COVID. So being in the lab for 12 hours a day, cutting up mice, I was also vegan at the time, wasn't the most fun. And I took a year off, and, we all thought it was going to be over in a year with the idea that I'd be traveling. Alas, that did not happen. We all experienced that. And a couple of my friends had stayed on to do PhDs. So Paige did honours after me. We actually met at O Week before we started our undergrad together. So I still had a few people I knew doing research, and I really, really missed the environment, but I knew I didn't want to do any more preclinical research. In pharmacology, they talk a lot about clinical trials. So it had always been pretty interesting to me. So I started to look around for any PhD projects that offered, clinical trial-based work. A lot of them were really heavily coding-based or retrospective. Neither of those were my, great interests or skills, even though I've kind of had to do them now. And I found a project with the Stroke and Aging Research Group at the SES looking at digital health interventions for secondary prevention of stroke. So essentially developing digital health interventions to reduce the risk of a recurrent stroke. So supporting people after they've had a stroke. So I applied for that, met with the supervisors, and hit the ground running. So I started off at the MMC last year, joined the Hudson Institute Student Society. So you can see me in the back with my hands up. You can also see Paige and Kayla on there. So joined that for my first year, and then as of this year, we've moved to the VHI. So that's where I'm at now, and if I've missed anything, I apologise.
No, that is really interesting. And so the digital work, is it an app to encourage people to breathe, drink water, exercise, stay in touch with their GP, things like that?
For people who've had a stroke, the major priority for them is to reduce the risk of another one, and that's through reducing blood pressure, taking medication, reducing their weight, managing their diabetes, exercising. So the main focus of my PhD is an app that syncs up with a wearable device and electronic messaging. So that's from a collaboration with the CSIRO. So I'm fortunate enough to work with them and work with people from the unit from the Australian eHealth Research Centre. And so essentially it's about tracking risk factors and supporting goal attainment and reducing their risk. So we've just finished a little feasibility study that I got to coordinate, and we're now applying for grant funding for an RCT.
Fantastic. Best of luck. Thank you, Liam. Lacey, could we hear from you, please? You'll need to unmute. Thanks. Yeah, could you tell us a bit about your topic and why you chose it and how you came to be doing honours?
Alrighty, so yeah, I'm a current honours student at the Hudson. I work in the Centre for Reproductive Health. So I came from a Bachelor of Biomedical Science at Monash, obviously. I took a year off last year, and then around August last year started looking for honours projects. So I was reaching out to a few different people, mainly in like the reproductive health area. I initially started looking through the MIRCI Centre because I'd done a unit in third year with them that was really interesting, and then kind of expanded when I realised that there was more to the, to SES than just the MIRCI Centre. So I reached out to my supervisor. Initially, it was a project based on testis biology, which at that point I was just looking for anything involved in reproduction. So I got in contact with her, and because I wasn't studying, I actually had the opportunity to do a bit of lab work last year and start picking up some skills, which is really great. And then through that time, the project kind of evolved just as, I guess, my interests became a bit more clear, and my supervisor started having a few different ideas about areas we could take the project into. So I'm now working on placental development, which is a bit of a change from the testis biology that I initially signed up for. But I am looking at the effects of dysregulation of a specific protein called activin A in the placenta, and then also if exposure to endocrine disrupting chemicals has any sort of interaction with dysregulated activin A. So this protein is seen to be dysregulated in preeclampsia if, excessive exposure to endocrine disruptors can interact with the pathologies of some pregnancy disorders.
Fantastic. We lost a couple of words there, but I think even I understood it. So that was terrific. Thank you, Lacey. Interesting work and very meaningful as well. Kayla, could we hear from you, please?
Yeah, sure. So hi, everyone. I'm currently a second year PhD student at the MIRCI Centre. So originally I had a bit of a weird background as well. I started off in midwifery nursing, and whilst I enjoyed my time there, I really wanted to dive into the research side of things. So I went to science at Monash, and I really had a passion for reproductive biology, pregnancy, perinatal health. So I really, obviously, wanting to go into research, I looked into honours years and what was offered around Monash, and I found that the MIRCI Centre offered a lot of different projects that really aligned with what I wanted to learn and what I was really interested in. So I went over to the MIRCI Centre during my honours, and I had the fortune, I guess, of working with large animal models at the MIRCI Centre, as well as experiencing a lot of lab work. And that year, meeting the people that I met and working with the people that I met, working in the situations that I was working in, made me really want to stay on in the MIRCI Centre. So at the moment, I'm in the perinatal inflammation and neurophysiology lab group, and I look at the brainstem and brainstem respiratory centres and how injury and inflammation in the brainstem can inhibit breathing of a preterm baby when they're born. And yeah.
Great.
That's me.
Thank you. Yeah, terrific. Paige, I'm guessing you're a pretty social person because everybody has mentioned you so far today. So when do you have time to work?
I don't know about that. But I am in that photo because I was president of the Student Society last year. So if anyone does have questions regarding the HIS, please reach out. And then we have the current committee, which you can see on the Hudson website, and I'm sure around the place on Monash websites as well. So if you did have questions regarding our student society, please do reach out. It's very engaging, and we run events nearly every month, for some in regards to student growth and career options and things like that. And then other times some fun events just to change up your day and have a free coffee and things like that. In terms of me doing honours, I had a pretty linear pathway, I would say. I was a science undergrad and I double majored in physiology and developmental biology. I went into honours because in the major for developmental biology, I did a unit called BME 3082, which I'm sure many of you are aware of. It's a fetal and neonatal health elective for biomeds and a part of the dev major in science. And it means you get to come to the Ritchie Centre. So the unit means that you get to do lab work. Instead of your traditional lab work, you come and attend the experiments on large animal models generally, or lab work that PhD students are running. So I help teach that unit now as a PhD student at the Ritchie Centre. We meet all of the third year students and we encourage them to come to this event and to come and do honours with us if they're interested. So that was my introduction to the Ritchie Centre, and I really liked the people that I worked with. I really I met my supervisors through that unit and I really enjoyed, we got along really well, we had a good relationship, and so I reached out to them to do honours. I ended up also taking a bit of a gap, 6 months, it was COVID, and so I did honours. I applied for honours the following year after the BME unit and then started the year after that. So I did my honours in 2021. And with the same supervisors who I now do my PhD with. So we're in the fetal and neonatal health group. I look at respiratory physiology and improving respiratory outcomes for infants born with underdeveloped lungs. And so, as Kayla mentioned, we do a lot of large animal work at the Ritchie Centre. And so it's a large animal model. We work in collaboration with neonatologists and obstetricians, gynecologists in our research as well, which makes it incredibly translatable. We generally have neonatologists in all of our experiments, and then they spend the second half of their day back in the NICU, and they're using the knowledge they learn from our preclinical experiments almost straight away to guide what they're thinking in the clinic. So that was a really massive draw card for me, knowing that I was having a bit of a direct impact. Also, the way that we conduct our experiments, there's a lot of teamwork involved, which was really important to me as well. I didn't want to be on my own in what I would call a traditional lab. I wanted my experiments to be really teamwork heavy, and that is something that we do a lot of at the Ritchie Centre. Yeah.
Terrific. So I'm getting the strong message that for all of you, doing meaningful work was important, not just, fluffing around with scientific. Needed to have an outcome that would help people. And certainly from the clinicians and clinician scientists we've just heard from, the big message is translational medicine. So that is terrific. And also you all seem to be people, you enjoy working in a team and sharing the success. That sounds lovely. I'm just keeping time of aware of the time, because I do want to get to Pilates. But could I hear from each of you one thing that was good about honours that surprised you? You didn't think it would happen. You didn't even know of it, but it happened. What would that be? Liam, can we start with you?
Can I palm one off to Paige while I think on this?
No, you can't.
I can go, Liam. It's all right.
Paige, don't protect him.
Well, I think mine's a bit of an obvious one, so I'd like to say it first. And
okay,
no one else can take it. I went into honours not thinking research was for me. I did it as a bit of a let's see what this is like. And I came out of it really, really proud of what I had accomplished, and realising that whilst it was a hard year, I really enjoyed it. And I signed up to do a PhD, and if you'd asked me before I started honours, I would have said, absolutely not, I'm never doing a PhD. And it really changed what I thought research was, and made it something that I really, really enjoy. So I didn't even know that beforehand.
Terrific answer. And we don't know what we don't know, do we?
Exactly.
So what a great effort on your part. Come on, Liam.
Probably upskilling. You really enhance your verbal and written communication skills in a way that I don't think you can in undergraduate. You know, writing a thesis is a lot more work than doing an assignment. So that was something I didn't expect, and being comfortable standing in front of everyone defending your research and what you've done. It's like your little baby. So yeah.
Yep, that's great. Lacey, what about you?
So something that I've enjoyed this year that I guess I wasn't necessarily thinking would be the way the year went was how, I guess, independent I've been able to be with my project and how much ownership I've been able to have over it. I did kind of think going into it that, you know, it would be like I'd be very like strongly supervised by my supervisors and that. And obviously they give me help when I need it, but I have been able to do a lot of the work and direct it myself, which I've really enjoyed being able to, like it feels like it's my project, you know.
Yeah, fantastic. It is. Yeah. I think it's also called adulting.
Yes. Yes, it is definitely a much more adult step up than an
which is terrific. That's what it's all about. Yeah, good job. Kayla, please.
Well, everyone took my answers. So no, probably the one thing I really loved about honours were the people that I met, the friendships that I made through honours. So Paige and I have been sitting next to each other for 3 years now. Liam and I met on his committee last year, and Paige, Liam and I were the president, vice presidents. And they're just, I still speak to people that aren't, that I did honours with that haven't stayed on for a PhD. It can be, honours is obviously can be quite a difficult time. It is a massive dedication. You're there, and while you love your work, you really lean on each other for support, and you're with these people all the time, and they're just friendships that maybe you haven't made in undergrad, or you don't get the opportunity to make in undergrad because you're going to different classes. These people, you see them every day, you work together. It's an amazing environment to be in.
Yeah, terrific answer. Lots of skills to learn, personal skills. Thank you so much. Thank you for donating your time this afternoon. I really appreciate it. Can we please move on to Associate Professor Simon Chu? Very sorry, Simon, I stole a couple of minutes from you. Could you please go over the graduate research process, please?
Thanks, Karen. Yes, so it's my great pleasure to be able to speak to you all tonight, especially all the students who are online. Well done on sticking the distance so far. You've heard some fantastic research projects that have been offered at the various institutions, and it's my privilege really to take you through the process. Now, I do so because I am one of the co-conveners of the Hudson Institute School of Clinical Sciences Bachelor of Biomedical Science Honours program. However, I also look after the Bachelor of Science program for those students who are on our campus, although I don't administer that side of things. I also am a research group head at the Hudson Institute of the Hormone Cancer Therapeutics Lab, and I have a lot of experience with PhD and honours students in my own lab. So it's my pleasure then to go through a bit of the process, but in order to do so, if we can move to the next slide, I just got a couple of introductory slides just to, get me into a little bit of a canter before the home stretch. And it's just reiterating some of the things that I've already said. So why would you choose biomedical science honours? Well, one is it lets you deep dive into specialised topics. And as you've heard through tonight, there are so many of these different broad topics that you could really be interested in doing. And especially what every honours student finds is you hone research-based skills and knowledge, things that you don't necessarily get in your undergrad year, but you really do get in your honours year. And in many ways, you're thrown in the deep end, but it's such a wonderful learning experience for you. As well as that, and it's really wonderful to hear a few of the comments already, you get to shape human knowledge. In other words, you get to contribute to real world research, making real advancements. And some of those lead to, as we've heard, also clinical trials and so forth. And so that can all start from the work that you do as an honours student. Another area is that it's also a stepping stone into the postgrad world. So after you've finished your honours, you've met the requirements for entry into many postgraduate research degrees, such as a PhD. And so it's a really important step for you. If you and whether you choose to do that or not, it can really enhance your career trajectory. So it gives you many employment options and prospects. Next slide, thanks. So, and I'm sorry, Marie, I've given a few of these horrible little sort of, the automation things. So in terms of the career paths, this is just give you a little bit of, you are playing with my mind. Thank you. In order to give a little bit of probably more of a traditional career path in biomedical science, and it doesn't have to go this way. Often after you've completed your undergrad, at least this is for Monash, whether it's a Bachelor of Biomedical Science or a Bachelor of Science at Monash University, or on the other arm, you're doing a bachelor degree in a relevant discipline from another institution. As long as you meet the requirements, then what you can do, next click, thanks, is that it can lead you to be able to be eligible to do honours. And so you get research training through a Bachelor of Biomedical Science honours, or at Monash, we also have 2 streams here, either a BMS honours or a Bachelor of Science honours. And that's a 1-year course. Next click. And then after you've completed your honours year, then you have the choice of either continuing on and doing a research or industry doctorate, which is traditionally about 3 years, plus or minus a few months here and there, or you can transition straight to the workforce. And it's a really wonderful thing there. And then the last click on this slide will be, it gives you a career basically in biomedicine, health sciences, and that can be broadly in a number of different sectors. And so it really is a wonderful way of being able to get that experience into that final career that you might be interested in doing. Next click. So what I'm going to do now is just give a broad overview of the BMS, the Bachelor in Biomedical Science stream. And I'm not going to, in fact, this is very similar to the Bachelor of Science honours scheme as well. However, there are just some very subtle differences, but I won't get into those at the moment. So the Bachelor of Biomedical Science honours program is comprised of two parts. The BMS 4100, which comprises 75% of your total mark, and it's a research project. So what this unit involves is it's a supervised research project that focuses on the research of a publishable at a publishable standard. And at the end of the year, that means you'll be able to present a seminar on your research, and you also participate in the thesis review, as well as you receive during the year training in advanced scientific techniques, and then yeah, okay, and then can I get the next click point? And so the assessment for this section is effectively it's your research project. So you have to write a literature review, which is due sort of around the mid-year mark, and it comprises about 10% of this mark. You also have to do a seminar early on, and the seminar is not scored. However, it's a way for you to begin your introduction into how to give an overview of your work. Later in the year, you have another seminar where you get to present your results and your conclusions of your work, and that comprises about 10%. And then lastly, your thesis, your full thesis comprises 80% of this total score. You finally have a thesis review, and this review is just it's an informal chat really about how your honours year went, but also it's a gauge of whether you really truly understood your project or not. Lastly, I've got little pop-ups coming up. The BMS 4200 is the second component of the BMS honours program. And what this unit does is it actually develops your analytical abilities, communication skills, and advanced knowledge in specific areas of biomedical science in a broad sense. So students will take a biostatistics module relevant to scientific hypothesis testing, and also provide a written critique of a scientific article. Students will also undertake a component of work within their selected discipline that involves some a level of advanced theoretical training. So candidates can start this unit again, like the other one, either in the first or second semester. Now, next click, please. The assessment for this section is, it's gone off screen slightly there, or at least in mine, that there's a discipline-specific component which comprises 40%, and at the Hudson SES, that comprises of, we have about 9 or 10 lectures, and we have an essay, require an essay on one of those lectures. That's about 20% of the mark, and also a poster presentation, which is 20% of the mark. And then there's a common core component, which is done by all the BMS students across campus, which is 60% of this unit. That's a biostatistics course of 30% and a written critique of 30%. Next slide, thanks. So how do you go about, what's the process of this? Well, firstly, you need to find out whether you're eligible or not to, you meet the requirements, the criteria of each of the programs. And so I've got here, and you will get links to all of these slides, a copy of these slides, no doubt. All of these links will take you to the exact place you want to go to find out whether you meet the criteria. So each of these programs all have maybe slightly different criteria, but you need to check whether you meet those requirements. Next. Then when you need to decide on the project. Now, in terms of deciding on a project, you need to actually discuss or talk to potential supervisors. So you need to approach them and ask them about their projects and what it will entail and what techniques you will learn, and basically really find out if you're interested in that project or not. Also, we advise talk to current and past honours students, and also talk to the course coordinators in all the different departments that you may be interested in working at. Now, where do you find those projects? Well, firstly, you can find all the projects in Supervisor Connect, but then you can also go to the relevant websites that I've listed for the Hudson and the School of Clinical Sciences there, the links where you can find the project booklets, and no doubt the same for the Victorian Heart Institute as well as the Monash Centre of Health Research and Implementation. Pop up again. Okay, and then when you've found your project, then it's a matter of applying for it. So how do you do that? Well, then when you want to apply for honours in a biomedical science related field, you follow these steps. For a Bachelor of Medical Science honours, you go to that link that I've listed there. If you want to go through the Bachelor of Science honours stream, you've got to click on the next link. Click, please. Then the process for each course, again, is slightly different, but again, I'll just reiterate, check for entry requirements, find a project and supervisor and talk to them. And then for all of honours students, you need to download this application form. And it will have a click box there for either BMS honours or BSc honours. Then you fill in the form and you need to send that to the respective honours coordinators. Now, at the Hudson and Southern School of Clinical Science, that's myself and Dr. Paul King, who's a member of the School of Clinical Science, and we then get to approve or not approve that application. If it's through the Bachelor of Science honours, then you need to contact the respective department honours coordinators up at Monash University, and that could be the Department of Biochemistry or Microbiology or wherever it is on that website. And I've provided a link there of all of those coordinators, and what they will do is they'll approve your application, and then it will finally come back to us at Hudson to approve it as well. Then the last step here is to apply for the respective honours course using Monash University's e-admission form, and I've got the link there. So that's the very last step, and you need to put in the right, what the right course is, and no doubt all of you students are probably very aware of that process. Okay, and now I guess I'm just going to end this again. If you come and do honours on our precinct, you really are joining a community. We've already had the HIS mentioned. where it really helps all students across all of the different groups on our precinct to come together, share ideas, network, support each other academically as well as socially. And I've listed a few things there, such as you've got your student retreats, your 3-minute thesis competitions, you've got some nice social functions that they perform. No doubt they change throughout the years, but those are some of the examples. But the other last part here, just to click, is that you get to be mentored by world-leading scientists and clinicians, and it was nicely mentioned at the very start, the close proximity we have with the hospital and with the actual bench to bedside type of research that's been conducted on our site, and that is a privilege, I think, that you will not get in many places in the world that offer honours programs, because we are so close to the clinic in many of our programs. So and those world-leading scientists, clinicians will help guide you and support your academic and professional development, and not just your direct supervisor, but broadly throughout the whole precinct. You'll find people that you'll be drawn to, and you'll ask questions, and you'll love their work, and you'll be able to really benefit long term. So and form networks. So it's a terrific place to work. It's a terrific place to conduct your studies. And please, we welcome your applications to us. And if you have any questions, then feel free to email me, and I'll be happy to lead you to wherever you need to go. Thanks, Karen. Sorry if I take.
Thank you. No, Simon, no trouble. That's very persuasive, particularly the dumping nights. We're in a good suburb for the dumping nights. So, can you just identify these two gentlemen at the bottom here? Who are they?
That's Professor Ron Farstein and Associate Professor Jason Kane, who are leading the Pediatric Brain Cancer Consortium. It's located on our precinct.
Great, thank you. Okay, thank you to all our speakers. We have a bit of time for questions and answers. So one question is, does each project only accept one honours student, or does it depend on the lab? And Marie would like to answer this. And Marie, can you just tell us about your credentials so we don't just think you're answering for the sake of it? You're well credentialed.
Oh, I am. I can't figure out how to actually show my face, so I'm going to hide. Oh, no, here I am. Hello. Hi. I'm Dr. Marie Balanzic. I am a member of the Ovarian Cancer Biomarkers Group at the Hudson Institute of Medical Research. I am also a part of the Student Education and Training Committee. So honours would depend on how many students your supervisor is willing to supervise. And I guess my advice would be to look at who would be supervising you, whether you'd be supervised by students or whether they had sufficient amount of postdoctoral staff to actually supervise you, so that you're not sort of rummaging around and fending for yourself when you're doing your honours here. We've run programs where we've had 4 honour students at one time, which has been amazing for the students, because you all sort of start on the same thing and you can encourage each other and work together, and really having that peer support in your lab and also within the institute that you're working in is really, really important for honours, because honours will be probably one of the toughest years that you do academically. Just basically because it's a little bit of a baptism of fire. You've gone from a uni degree to an actual work type based setting, where you sort of have to push your work. So choose wisely.
Great answer. Thanks, Marie. So there's some people put some questions in the chat, which is totally fine. And if you have another question that you don't want to type down, you can just raise your hand. So here's somebody talking about lecturing positions. So perhaps we can answer that elsewhere, because this is specifically for honours students tonight. There's somebody giving a link to virtual scientific events around the world. That could be very handy. Wei Ping is asking which institute offers honours master program research in dietetics and nutrition. I think Peter Ebling thankfully has answered that. Yep. So that, and all of this information is on our websites most of the time. If I decide to do a summer subject this summer, will I be able to commence honours right away next year? Could anybody answer that, please?
I can answer that if you like. Yeah, absolutely. In fact, it's sometimes a really good springboard into your honours project, although you're not allowed to be working on your honours project during the summer vacation internship. That's a requirement from the university. However, you do learn a lot of the skills that you're going to use during your honours year, and it's certainly a recommended thing to do if you're able to.
Right. Thanks, Simon. There we go, Gabriel. Isa is asking, are we able to look at projects at other research institutes, or does the project have to be at a Monash affiliated institute? Well, I think the answer would be just Monash.
Yes, I think if you're interested in what other research institutes are doing, you need to go to those other research institutes.
Yeah, it's completely up to you, but don't.
Sorry, Karen, the potential exception is if you had a supervisor at Monash, but were working at a different institute in a collaboration or something like that, then that might be a possibility.
Okay.
Simon, you could comment maybe. Sorry.
Well, yes, that's true too. Yeah, and there are other. Okay, so maybe to clarify that, for example, Deakin University may not actually offer our projects on their website or through their various departments. However, they will allow their students to do honours with us in collaboration with a supervisor at Deakin University. So that arrangement can be made. But in terms of other research projects that are elsewhere, that's up to the other institutions.
Sure. Thanks very much. And Kirsten McIver has a very practical question. Is it possible to work part-time while doing honours? And if so, how many hours or days per week is manageable while undertaking honours? Perhaps some of the students current students could answer that first, and maybe I'm sure Marie, you'd have some intel on that as well.
Yeah, I just, from my perspective, from a supervisor's perspective, I have had honours students that have done part-time work. It's really just about achieving that balance between having a life, being able to study, and also do your honours degree. You really don't want to burn yourself out. We do find, though, towards the end of the year, when the students are writing up their theses in particular, they will stop their part-time work and really focus on their studies and writing up their work. But it's really about you and what you find manageable for yourselves. And I guess the students can probably comment on that. Lacey, you look like you're nodding there, so yeah. Take it away.
Yeah, so I'm currently in honours. I started the year working, but I'm going to say I probably overdid it. So I was working about 20 hours a week on top of honours, which is meant to be 9 to 5. And I burnt out pretty quickly and I stopped working in April. But there are other students in my lab who are still working. I think they are probably more on the range of like 10 hours a week. So they will do mainly weekends or Friday nights. I think it can be pretty difficult to do during the week when you're at uni from 9 to 5, and then I would go, say, straight to work and work 5 to 10. That's a long day. But weekends, I think, is doable.
Okay, fantastic.
Actually, Lacey makes a really good point there. For those students who are wondering, honours is actually like you are embarking on a full-time position. It's not a undergrad course. It's now a research project that requires attention throughout the whole year, and I think it's a really important point, because sometimes students will come into the program and not realize that, and sort of wondering why all of a sudden they've gone from 20 hours a week, the lead time at university, to 38 hours as such. So
yeah, good information.
Can I jump in there? One other possibility, Kirsten, I think, and Simon will comment on this, is that you could consider honours part-time. So if you need to work, then maybe you can do part-time work and part-time honours.
So there's a question in the chat about whether honours is full-time for the whole year. Do you get any holidays? Sorry, that's actually a misreading question. Yes, we do allow part-time honours. It's actually very rare, and there needs to be a really good reason to do so that's approved by the faculty for that purpose. So there is a provision to be able to do honours part-time.
Yeah. Perhaps if someone has a small child or is training for the Olympics or something, there would be compelling reasons to let them do that.
I think, Karen, also to answer Savannah's question, it is full-time in terms of your week-to-week workload, but it is not for the whole year. You will start generally around the start of March when semester 1 starts for the undergrad students, and you finish thesis submission is generally around middle of October, and then you're likely to have a few commitments into maybe the middle of November. But that's probably when things will wrap up. Occasionally your project you might want to stay on over the summer a little bit so that you can write a paper and publish your manuscript associated with your honours, but that's dependent on the student and the supervisors as well, and is not a requirement. So it's not the full year. But you don't have that middle holiday that you will be used to from undergrad. You work through that, and you generally, and correct me staff members if I'm wrong, but generally you will follow the Monash University public holidays only, and not the Hudson ones. Yeah.
Can I also quickly input and say that for me, I needed to work, but that was a conversation that I had with my supervisor. So that is also something that I would highly encourage. I guess it is completely dependent on them and how much you are required to be face-to-face as well. So have that conversation, ask those kinds of questions, especially when you're first meeting them as well.
Fantastic, very helpful. This will be our last question. Are there many scholarships available? I don't know about the answer for many, but the information would be on the website, wouldn't it?
Yeah, thank you. I forgot to mention about scholarships. There are scholarships available. There's only a limited number for the whole of the faculty. I think there's 35, I'm not sure, for the whole of Monash University. And they're about $6,000 stipend.
For the year.
For the year.
Okay, terrific. Thank you very much. We will wrap it up. Thank you, everybody, for your time, for the participants who have sat there in silence for an hour and a half, for our wonderful speakers, very engaging, very informative. Why wouldn't you do honours at Monash? Thank you for everything. Please have a healthy dinner. We don't want to see you at the VHI in the near future. Look after yourselves, and please get in touch with anyone if you have any more questions about the process. Thanks so much, everybody.
As a quick thing, we have a QR code here if you're interested in coming on site to do an actual tour and to meet some of the people that are within the centres where you're interested in doing your honours. So just you can register using that QR code and we'll be in contact with you.
Right, thanks, Marie.